Allow me to introduce you to somebody who's very special to me. I first met Brian when I was a primary care doctor to Boston's homeless population. Frustrated, depressed, and struggling with severe neck, shoulder, and back pain, Brian just had enough. He said, "Dr. Roy, I just can't take it anymore." In addition to Brian's chronic medical and psychiatric issues, he had also just lost custody of his son and lost his job, both of which drove him into deeper depression. Ashamed but desperate, Brian started to use heroin to numb his pain and suffering, and he just couldn't stop. Sadly, Brian's story is not unique. It turns out that the leading cause of death amongst Boston's homeless population was drug overdose. And when that data came out in 2013, it completely transformed the way that I provided care. But in most cases, like with Robert and with my patient Brian, the true causes often are stressful, difficult, challenging, traumatizing experiences. Unemployment, illness in the family, loss of a loved one, divorce, physical, sexual, verbal abuse. And all of these, and in the case of, say, my patient Brian, who lost custody of his child, had severe physical and mental pain. All of these stressful, difficult, traumatizing experiences, either one individually or a buildup, leads to complex emotions such as isolation, grief, frustration. But the case I'm going to make is that these underlying traumatic experiences create these complex emotions: isolation, grief, frustration, anger. And when we're not in an environment where we can address those emotions in a way that's healthy, then we often self-medicate with drugs, with alcohol. And by the way, I'm not saying that everyone who experiences something that's stressful and traumatizing automatically develops addiction. I'm not saying that. However, what I'm saying is that almost every one of my patients who I've taken care of who has addiction has some type of exposure to something that was traumatizing or stressful. There is a very strong correlation. So, I learned about the brain, and it turns out that the before I understood how addiction worked, and I blamed patients like Brian and Robert for not taking responsibility. By listening to their stories and learning about the brain biology of addiction, I had a far better understanding of how drugs and alcohol were impairing key parts of their brain that controlled emotions, cravings, decision-making. And then there's this third part of the brain called the prefrontal cortex, which is the front part of the brain here that's responsible for complex decision-making. Now try to making those decisions with substances on board, drugs or alcohol. And these are the three stages. The first stage is, you consume something that's intoxicating, and you begin to experience pleasurable, rewarding effects. Think about, you had maybe 1 or 2 glasses of wine over dinner, feel a slight buzz, right? And then the second stage, a person experiences a negative emotional state when you're not using. I sometimes think about my mother when she hasn't had that first or second cup of coffee. She feels a little irritable, right? The third stage, a person seeks a substance after a period of abstinence. I think about my patient Robert, who went quite some time without drinking, but then he relapsed. But that's actually, turns out that's very, very common and expected in addiction. It's not a failure. And frankly, I also learned that relapse rates actually are sometimes even higher in other chronic illnesses like asthma and high blood pressure. We just don't think of people with those other chronic illnesses as relapsing like we do with addiction. So then what happened to my patient Brian? So the first thing I said to him was I thanked him for taking the time and effort to come see me and share his story. I then said that we were going to work together to get you the care that you need and you deserve. I connected him to psychiatry, orthopedic surgery to help with the pain, case management, and social workers to help with the job and housing. Over time, after months and months and months of hard work and resilience on Brian's behalf, attending multiple medical appointments and counseling group sessions while navigating the challenges of homeless life, today, years later, Brian, I also started on buprenorphine for opioid use disorder. So today, after doing all these things, Brian now has an apartment. He has a relationship with his son. He is now in long-term recovery, I'm very proud to say. In essence, Brian's life today has a sense of purpose. On that note, I thank each and every one of you for taking the time and effort to listen to my story. Thank you very much.